Start with a smile. Hello everyone, Dr. John Bartemus here today with a functional medicine Charlotte. Let's start over. See? I messed up too. Actually, I can just keep it.
Okay.
Start with a smile. And just stop and start the video. Hello everyone, Dr. John Bartemus here with a functional medicine Charlotte patient Amy, and she's here to tell us her story today. So Amy, why don't you give us an idea of kind of what you struggled with and why you were led to functional medicine?
Okay, so I was diagnosed with Graves' disease back in when I was 15. My sister, I had lost my middle sister to a car accident probably about 6 months before I was diagnosed. And what's interesting is my oldest sister and I both were diagnosed with an autoimmune disorder about 6 months after she died. So they think like the stress from all of it, I was probably predisposed to getting it anyway, but they think the stress just brought everything out. And so my journey kind of started with a doctor who made the mistake of telling a 16-year-old gymnast who was pretty body conscious that if you take whatever it was, Tapazole I think, that you could gain like 5 to 10 pounds. So I was not really great taking my medicine when I was first diagnosed with Graves. And I actually kind of didn't mind a lot of my side effects because at that point in the early stages of everything, it was just, I could get a lot done. Like even through like college and everything, I was known as the person who could take like 21 hours, work a part-time job, run every day for hours. Like I just kind of had that motor, like an Energizer Bunny motor. And I didn't have a whole lot of side effects. But then once I graduated and started teaching, things kind of took a turn for the worse, where I started to get really bad anxiety with it. I would get a racing heart with it a lot. And they could never really and at that point I was finally like, okay, I need to take this medication. And so I would go in and get my lab work and take my medicine, but it didn't ever really help much. So I was kind of on this constant roller coaster ride, which now looking back might have been like flare-ups. Yeah. Probably, yeah. But I didn't know that at the time. I went to several endocrinologists, and the biggest thing, one of my biggest symptoms was always really bad anxiety with it. Not to the point where people would know that I had anxiety, but just inwardly just kind of feeling like freak out all the time. Yeah. So I was finally recommended to get radioactive iodine, and I didn't want to go that direction because it was right when Jason and I got married. We knew we wanted to have kids, and I was just really leery of having radioactive anything in my body before I got pregnant. And so it was recommended, I think, just take your thyroid out. I just trusted that, okay, that's what I'm supposed to do. We can't treat my Graves. My thyroid was a little enlarged, probably not real bad. So in 2005, I got my thyroid taken out. So now I'm Hashi's. And so that just, it was pretty stable for a while. Actually, through both of my pregnancies, I probably felt the best I ever had.
And were you medicated during those?
Yeah, I was very heavy. I was on like 225 Thyroid. But just, I think through stress and everything that my life kind of encompassed at that time, I just started to get a lot of crazy symptoms that just, and my doctors were kind of just dismissing a lot of it. So I would get the bad anxiety and bad joint pain, and I was always really, really tired, and everybody would just say, well, you're teaching, and your husband and you own a gym, and you're heavily competing in CrossFit, and you have 2 really small kids, like, of course you're tired. And I'd say, well, this is like cement in my bones, like I just want to wake up and go back to sleep. It's not like, and I would get through my day and I would do things, and I think the hard part for me was being a person who everybody kind of looked to as like the person who can do it all, like the dependable one. So it's hard then to put yourself out there and be like, no, I don't feel good a lot. I'm just kind of going through life and not feeling good. And at one point I think I even I'd seen all these different doctors. They wanted to put me on Klonopin, blood pressure med, just everything, because I think my anxiety at that point was so built up that I finally heard about Dr. John and heard really, really good things, and just, I needed to know the root cause. I knew that I don't have a thyroid. I know I'm now on a replacement, and I knew that there had to be a better way. So I started working with Dr. John.
Yeah, so we in functional medicine, we're trying to look under the hood to see any and all causes. So it's probably fair to say if you saw endocrinologists, obviously they were focusing on thyroid and the endocrine system, but maybe never looked at gut or looked at blood sugar or looked at iron levels or looked at the system.
Once a year.
Yeah. So we did a comprehensive look at the system and found the priorities that were Amy's priorities that need to be dealt with, and we've dealt with them and been dealing with them. And what have you noticed, or how has your life changed, health changed?
Just a lot of really good things. Just eye-opening that what the root, you can't ever go back in time. So it'd be really cool to have this conversation like 10 years before my thyroid came out. But can't reverse all of that. But just to see the interconnectedness of everything, the importance of the gut health. And I thought that I was being a CrossFitter and eating close to paleo and all this, I thought I was doing a lot of the right things, but I was really deficient in some things, really imbalanced in some things. So I've noticed definitely increased energy for sure. I'm not having highs and lows, like I'm kind of just steady motoring through the day. That's probably one of the biggest things.
How's the anxiety?
Anxiety is a lot better. I'm still, so now that I've worked a lot with Dr. John, I have a new thyroid doctor on board, and we're still playing with some T4, T3 combinations, because my T3 was really, really low. And so we're working on that. So some of the anxiety, most of it has gone away. Some of it with working with new medicines and trying some new thyroid things is still there, but it feels definitely like 20 times better. Because I was to the point where before I started working with you, where I was starting to avoid like social, without even realizing it. I was always just kind of an excuse, like the boys are busy, or I have to do this, or I was starting to avoid things that I normally would enjoy, and that was when I finally got to the point where I was like, okay, I can't.
Yeah,
I can't avoid it anymore.
Quality of life.
Yeah.
So is it fair to say that you're not avoiding social gatherings anymore? The anxiety is more about, hey, I've been on Thyroid for decades, and now I'm a little anxious about switching medications because I know what I'm getting with Thyroid at least. Yeah. So why have we worked with a different endocrinologist to switch the medications?
This new my old endocrinologist, really nice guy, but he only saw me once a year, and he only looked at 2 lab values. So we were only ever looking at TSH free T4, which my free T4 was really great. So I had no idea my T3, and even my antibody count before I went gluten-free and everything was super high, which was playing into everything that was going on. So I kind of had to make the choice, like I can't, and he was quick to wait. I mean, it would be a 2-minute appointment once a year. Like, oh, your labs look fine, and I'd be like, well, I don't really feel that great. Well, you're busy. Or should you be working out as hard as you're working out? Probably not, but I didn't.
But so that is putting it back on the patient when, a thorough thyroid panel is going to be 9 markers, and they're running 2 and trying to say, hey, you're good. And the one T3 marker that's actually telling you the metabolic function of what's thyroid in your body wasn't even looked at.
No. So now I go to somebody, and it's going to be a process, but I feel like I'm ready for it because of all the work that we've done. Now I feel like my body's a much better environment to change, if that makes sense. So she's seeing me every 8 weeks right now and she's running all the lab tests, and she's really fine-tuning it, and she's even to the point where she's like, even when we find your optimal, because everybody's thyroid optimal is pretty different, you can be in range but still feel really bad. Once we find your optimal, we're going to plug those numbers in, and we'll still blood test you every 3 months. Like, it's not going to be once a year deal.
And a big deal about working with this endocrinologist is she's open to changing the medication. So Synthroid and the ones that are used commonly tend to have binders and fillers that have gluten in them or cross-react with gluten. So we're getting pure medications without those things that will will help you and not hurt you at the
Right.
same time.
Yeah. So it's refreshing to finally have, and I think one of the refreshing things too was being used to, for so long, going to a doctor and just kind of I don't need validation, but just kind of saying like, no, you really should be feeling okay, like, and then coming in here and John running all the labs that he did, and finally somebody being like, no, you probably really shouldn't be feeling all that great with all this stuff that you have going on internally, was kind of like a breath of fresh air compared to what I was used to, because I've been to 4 or 5 endocrinologists and a lot of different general practitioners who just were quick to be like, let's try Klonopin, let's try, and I was like, no, I don't.
Yeah.
Like, I'm not opposed to people who truly need things like that, but I'm just, for me personally, I knew it wasn't something that, I knew it was something that was coming from my body, just not working.
She's screaming from the inside, figure me out.
Yeah.
So excellent. Thank you for sharing your story and your time. And if there's someone on the fence about it, or maybe weary of like non-mainstream care, what would you say to encourage them?
I would, without a doubt, you have to, I mean, your body is such a intricate system and everything's connected, and you can go to 5 different doctors who aren't talking to each other and be on 10 different medications and nobody's really figuring out. So if you want to know the root cause of why your system's out of whack and what needs to be fixed, this is definitely, I would say any thyroid patient needs to have some kind of functional medicine along with their conventional care, because it's, I mean, just with how the thyroid imbalance is, your whole body, I mean, your whole body is just, I was deficient in B vitamins and just selenium, things that I wouldn't have ever known to. And not only that, some doctors will say, well, take vitamin D, or you might need some B12, and you go to CVS and you pick up a bottle of pills and you think that you're really, really helping yourself. But then working with John, I figured out, okay, my stomach doesn't absorb like I need to take liquid D3 and liquid B complex and those things, and I would have never known that, because doctors just tend not to dig into those layers to figure out what's working and what's not.
Right.
So I would definitely say check it out. It's worth worth the time and investment for sure.
Excellent. Well, thank you very much. And if you want to hear more, check out the podcast on iTunes, and we're always active on Facebook. And we'll see you next video. Have a great day. Awesome. Thank you.
I'll share it a lot.